Hello and welcome. I'm your host, Neil Howard. Thank you so much for joining us here on Health Professional Radio. In this segment, we're going to talk about the Astellas Oncology C3 Prize. Now, the Astellas Oncology C3 Prize, or Changing Cancer Care Prize, is a global challenge that funds and advances the best non-treatment ideas to improve cancer care for patients, caregivers, and the broader oncology community. Dr. Anthony Yanni is joining us here this morning as Senior Vice President and Global Head of Patient Centricity at Astellas to talk about how the C3 Prize has helped innovators fuel their big ideas since it was established back in 2016 and how it fits into the company's patient-centric approach. Welcome to Health Professional Radio, Dr. Anthony Yanni. Thank you for joining us this morning.
Thanks, Neil. Great to be here.
Well, tell us a bit about yourself.
I practiced clinical medicine for about 12 or 13 years, and I'm an MD by training. So clinical medicine is really the first thing I've done in my career before transitioning into pharma. I've worked in pharma now for about 12 or 13 years, but have been very fortunate to have had patient-facing roles even within pharma. So my career in pharma has been focused mostly on this patient centricity idea. How do we get patient perspectives in all disease areas where we focus and integrate them into both the process of new drug development and also into the decision making. So we change the way we develop those next generations of medicines, not only for patients, but with patients.
So what is the C3 Prize and what do the judges look for when they're choosing a winner?
Really, the C3 Prize, you said it best during the introduction. It's really about non-treatment opportunities for innovators across the world to present their ideas on how to streamline and help cancer patients navigate their patient journey to make it a little bit easier or perhaps a little bit more efficient for them. So we look for all kinds of ideas, whether it be educational ideas, so patients can better understand their disease and their options for treatment, digital apps, or just simply support systems for patients and their families as they undergo treatment for their cancer. So really, there's no limit to the non-treatment ideas, and we welcome everyone to study and understand the different journeys patients have and bring their ideas to help make that journey a little bit easier for patients.
Now, when you're talking non-treatment, could that be anything from a book, certain exercises, or what exactly when we're talking about non-treatment?
Yeah, so it's a great question, and it's one of the things we really try to focus on because we know that there are a lot of great minds working on medicines and injectables and pills for patients with cancer. What we also saw was there's large gaps in care when it comes to those non-medicine applications for patients on their journey. They have difficulty with childcare. They have difficulty understanding their disease diagnosis and treatment. They have difficulty with this year's winner sharing what symptoms I'm having during treatment that are important. So what we really encourage people to share with us is the things that they see that are missing in the journey for patients beyond the treatment for the cancer itself, but would make their journey a bit easier for them, their patients, their families, and their caregivers.
So who can submit an idea? Are we talking anyone at all, or do you have to be somehow involved in the healthcare industry some way?
No, we welcome ideas from anyone. And in fact, many of our submissions have been people who have either themselves experienced cancer or a family member, and they saw up close the things that they saw a problem up close and came up with a solution. So being a healthcare provider is absolutely not a prerequisite for submission.
So once someone submits an idea, what's the time frame that we're looking at before they know whether or not their idea has been selected? And is it just one idea, or do you have, say, idea 1, 2, and 3?
Well, we ask those that submit. Basically, it's a programmatic approach. We have judges who have experience in business and in healthcare and in innovation, so they submit their ideas, and it's definitely a couple of months of time between the submission and the ability for our process to thoroughly review all of the ideas and choose the winner. We do ask that the individuals submit their singular idea But there's no limit to the number of applicants for any single year. But we do want to be careful when we review everything, that we give everybody the thorough review, their ideas, the thorough review they deserve.
Is there some type of a scale that judges use to determine this idea over another?
Yeah, I think that the judges, as I said, they're from a very diverse background of innovation, healthcare, education, business. So they really look for an idea that's going to change the way, in the most impactful sense, the patient journey in cancer. So it's not as if we look at any particular year and say, well, this year we're going to look at a digital app, or this year we're going to look at an educational opportunity. It truly is looking across all of the applications, and how do we identify the single idea that we believe is going to be most impactful. And to be quite honest, many years we have multiple great ideas. It's just a matter of trying to choose, and it's a very difficult process, the one that we think is going to be most impactful. And we encourage those who apply or submit ideas any single year to resubmit. We absolutely encourage all ideas to come forward.
What exactly does the prize entail, and what's particularly inspiring about this year's C3 prize winner?
So the prize itself is a financial support, $100,000 for the winner to help develop their idea. We also provide expertise in furthering the idea. We have two partners, Slalom and Matter, who also provide professional resources for the winners. So it's both a monetary award and also expertise to help them bring their idea to fruition. This year, the idea was a terrific one, Amy DeGolier from Represent, and it was addressing this idea that what's pretty apparent when she brought the idea forward is that sometimes patients in their treatment process don't understand what symptoms they're having that are important for their physician to know about, and which ideas are expected and not so important. And she had a family member who suffered the consequences of an adverse event and passed away. And so this is where her idea came from. And so her idea was a digital interface between the patient and the healthcare provider that allows the patient to submit the symptoms they're having on a daily basis, and allows the healthcare provider to see it and decide which of those symptoms are unexpected and how can we intervene before something negative occurs. So just a terrific idea, seeing a gap and providing a solution for both the physician, the healthcare provider, and the patient and the family.
Tell us where our listeners can get involved, learn about this prize, and get much more information as far as when to submit, the deadline for this for submittals in the future. And can a person, you say you can resubmit an idea, but can a person win twice?
Sure. There's no restriction. We really look for the best idea among many, many great ideas. So yeah, we encourage all ideas, all people from around the world to submit whatever they see as a potential solution for patients. And please, for anyone listening, go to AstellasOncology.com. It'll get you into the Astellas website in the oncology space, and you can look around at some of the things that we have on there, as well as a link to the C3 prize.
Well, I appreciate you joining us here on Health Professional Radio this morning, Dr. Yanni. It's been a pleasure speaking with you. Hopefully we'll speak again and talk more about these innovating ideas.
Thanks, Neil. Great to be here.
You've been listening to Health Professional Radio. I'm your host, Neil Howard, in conversation with Dr. Anthony Yanni. Audio copies of this program are available at hpr.fm and healthprofessionalradio.com.au. You can also subscribe to the podcast on iTunes. Listen in, download at SoundCloud, and be sure and subscribe to our YouTube channel at youtube.com, Health Professional Radio.